Hello everyone, my name is Dylan Ketterman and I have done my final project taping on France. In Tool 1, it was regarding socio-political and economic analysis. We begin to compare countries by their HDI and GDP and other socio-political and economic trends. In France, 85% of the population is Roman Catholic. The gross domestic product is around $2.9 trillion and the GDP per capita is $42,000 and $732. In 2014, in the United States, the GDP is around $17.94 trillion and the GDP per capita was around $46,000. France lies to manage their care on the national level and state or local levels by having a lot of strikes and reforms. The cross-cultural dominators of these two countries regarding these impact numbers would be that both countries are fairly large, even though the US is larger. They both have a lot of important imports to help them with the GDP. I wouldn't say that in France their system is to promote or limit the health of the care citizens because they use a Bismarck model, and it is looked at as a leader in national health care. Everyone gets taken care of because over 77% of healthcare expenditures are taken care of by the government. In the US, we spend the most GDP on healthcare, but don't match up anywhere where France is on a success rate. The water and sanitation in France is universal and good quality. Water losses in France is around 26%, but are higher than those of Germany, which is 19%, and England at 7%. In Tool 2, it is involved by demographic analysis. The population of France is around 66 million compared to the 318 million in the United States. The dependency ratio of France is 59, where in the US it's 50. The infant mortality rate of France is 4 deaths to every 1,000 live births compared to 6.26 in the United States. The average age in France is better than the US, with France living to an average of 82 and the US at 78. The sex ratio is 0.98 males for every female. The net migration rate for France is at 1.09 for every 1,000 versus 2.45 in the United States. All these indicators influence health and health services. For example, the average mortality rate of a country could easily be compared to the type or quality of care a country may offer. Also, if the outmigration of a country is extremely high, that may be because an indicator that relies that citizens are leaving for possibility for better healthcare. In Tool 3 was about epidemiological analysis of France. Unintentional injuries in France are quite prevalent. For example, among 15 to 24-year-olds, 791 suicides were recorded last year, and that's 12.1% causes of deaths, and 70 homicides. There's a higher mortality rate in males in both US and in France. Traffic accidents represent 78% of deaths of fatal accidents in adolescents aged 15 to 19 years old. Cancer, however, kills 40% more men in France ages 35 to 64 and 10% more in women from 35 to 44 years of age. Similar to the United States, in France, anyone can smoke or drink if they're over the age of 21. A surprising number is that it is illegal to drive a car in France if your BAC is over 0.05, where in the US it is 0.08. In Tool 4, it involves health provider analysis. Just like in the US, France has doctors, nurses, dentists, and pharmacists, and so on. Most are in the private sector and charge patients on a fee-for-service basis. There are more doctors and nurses per patient than in the US. There's 3.2 physicians for every 1,000 people in France, and 9.3 nurses per 1,000 in France. Surprisingly, in France, French physicians make a fraction of what doctors make in the United States, and internal medicine at around $52,000, and specialists around $62,000. They pay no cost for education unlike us in the United States, and there isn't much malpractice, unlike in the US as well. Medical training differs a little in France compared to the United States. There's a 2-year cycle called the PCEM. It involves a general scientific training not delivered in hospitals. The second cycle is called DCEM. It's a 4-year of intense medical training dedicated to pathology and therapeutics. Following this is a 3rd-year cycle after being certified. Tool 5 consisted of health facilities and organizations. The hospital in France are publicly owned and managed, provide 62% of care, while 18% is split between profit and non-profit hospitals. There's over 4,200 hospitals in France and 104 beds for every 10,000 people. France have Spartan facilities. The French spend more money on care than any other European countries, but they don't spend it on facilities. French doctors are frugal when it comes to furnishing and ambience. There are also no file cabinets for medical bills. In Tool 6, this involved health and finance. Healthcare is paid for in France by the Bismarck model. It's financed by the government through a system of national health insurance. It's a single-payer system with transparent fees. Private doctors treat patients who buy health insurance to cover most of the cost. France was ranked number 1 by WHO assessment of the healthcare system. In 2013, France spent 11.8% of GDP on healthcare, compared to our 17.8%. France comes out to around $3,200 per capita versus our $8,900 capita in the US. People go to the doctors about 8 times a year in France. Healthcare is considered a fundamental right, and citizens can't get turned down, and there are no pre-existing conditions, and they cannot deny a claim. There's also no deductible, and a risk pool for this system is that they are operating at a deficit, and the costs of the system are increasing faster than the economy. A suggestion that I have to make France healthcare even better would be to cut out treatments such as spa treatments, tax rides to the hospital, reimbursed by the hospital. Reform is needed fast since it exceeds its annual healthcare budget by billions each year. Those preventative care exercises now look like a luxury and are wasted taxpayer euros. Thank you very much, and I hope you guys enjoyed.